Hello and welcome to Culture of Caring. I'm Natalie Boyle, your host, and I'm so excited to be with you here again today. So today we are going to be talking about one of our values, so one of the values that Mommy's in Need really lives by, and that's the value that we are compassionate. And I'd like to read to you what that really means. It means that we are aware of the suffering of others and share a desire to relieve it. We practice forgiveness, kindness, and honesty, and turn towards rather than away from difficult situations and conversations. And we give grace to ourselves and to others. And that last one is, man, isn't that hard? It's easy to give grace to other people, but giving grace to yourself is the one that in there I just always remind myself is if, as kind as I am to other people, try to remember to do that for your own self. So we have a wonderful guest on today. I'm so excited to introduce you to Dr. Marjorie Milici. She's the medical director of PD Place.
Awesome. I'm glad to be here. Thank you for having me.
Thank you so much for coming on. So to start us off, can you just tell us what is PD Place?
So PD Place has been a freestanding clinic for the last 25, 26 years. In Denton County, where it is located, there is no hospital for the county, like Parkland for Dallas.
Yeah.
So all the ER doctors in Louisville and Denton were realizing that the kids with Medicaid were getting their primary care through the ER. So about 25 years ago, they said, you know, this isn't working for anybody, and we're trying to keep the kids out of the ER and keep them healthy. So they modeled it based on a private practice, which is very unusual, and started PD Place. And we take children who have Medicaid, CHIP, and are self-pay, and we have different grants to help those who are self-pay. Taking care of people who have a difficult access to care.
And so is this all primary care or is it specialties? What all do you guys do?
It's a little bit of everything. It's mostly primary care and well care. Obviously when they're sick, and through COVID we saw them when they were sick and triage them to the hospital as we need to. Yeah. We also have volunteer doctors, and they come in and help us out too. And we have connections throughout the Metroplex for our subspecialists. We have a GI Dr. Butler, that comes once a month and does some gastroenterology for us. Yeah. And COVID has cut down on our volunteer staff, but we hope to build that back up as COVID minimizes.
Yes, hopefully.
Yes.
Well, and tell me, does it serve, so is it birth to 18? What is kind of the ages?
It's birth to 18. I'm coming from private practice, and I did a lot of college medicine, so I'm used to birth to 22, so it's getting difficult to lose those college kids. But if they do have special needs, we usually will keep them until their 19th birthday.
Okay, and then tell me about that. So you came from a career where it was mostly in private practice, correct?
Right.
And now are in this kind of very different environment. So what led you to kind of make that transition?
The timing was right. COVID brought everything to a head.
Yes, it did. And
let me see what is really important. It was very hard for pediatricians during COVID. Kids weren't getting COVID in the beginning, but they also weren't coming to the doctor, and they weren't necessarily getting the well care they needed, and they were scared to come. So a lot of pediatricians found a natural decline in patients. As I was at home periodically, working from home, I realized, first of all, telehealth is an excellent resource, and we all learned very quick how to do telehealth. And that to me, it wasn't about the numbers. It wasn't about the quality of care numbers and the amount of money you were making and the amount of patients you were seeing. It's about the individual. Yeah. And I felt like I was having to see so many patients in private practice. I wasn't able to relate and spend as much time with each patient as I wanted to.
Yeah. And so, you know, kind of in making that move, what are the differences that you're seeing in terms of what the kids might be experiencing that you're seeing at PD Place?
So the first thing everybody was like, oh, you're going into a Medicaid clinic, and my premise was all families are basically the same. Amen. They love their kids, and we want to help them have their family grow and be healthy. So that isn't really any different. The things I've been surprised about, one thing PD Place does really try to do is talk to the families in their native language. So probably about 50% of the patients I see are Spanish speaking. So we have interpreters that go in with us, and we make sure the parents understand in their primary language what we're saying to them. We do have some Burmese patients, and they usually bring their own translator. I've had some deaf patients, and they bring a translator. So the translation makes the appointment longer, but you feel like they really understand the plan when they leave, which when you're seeing 24 patients versus 12 to 16 patients, sometimes you're worried that things were missed.
Yeah. And so in terms of before this existed, you're talking about, children are really only getting their medical care through the ER, which is obviously not the best situation for anybody. But, what do you see in terms of, we're all about, providing childcare for healthcare access. But, one of those things is really the importance of preventative care, the importance of getting to those regular appointments and of having the same doctor that you're able to follow medical conditions through.
Right, because a lot of it is learning the family and the family dynamics and the child's personality, and then you can tell when they're sick. And if you don't know them and you only see them once through an ER, it's a totally different thing. It's like put a little Band-Aid on it and send them away. Where we're trying to take care of the whole family, the whole child. We have programs about reading, where all the kids on their well checkups get books.
Oh, I love that.
We have a food pantry at the checkout, so they can just take what they need with, some dignity, and make sure that people at home aren't going hungry. One thing I was surprised about when I started at PD Place is the families have a lot of children. I did not realize how many children they were going to have. And one of my first days there, I had a family with 10 children living in a 2-bedroom apartment. And I was trying to convince them, with so many people in such a small area, they need to get their COVID vaccine. So we have been very blessed at PD Place to be able to give out COVID vaccines, not only to our patients, but to their families.
That's great.
And it has been a wonderful way to disseminate the vaccine just right where they're used to coming for their health care.
Well, and I would assume that being that they already trust you guys, that you're then able to make that connection in a population that tends to be hesitant for
Exactly. And I was a little discouraged in the beginning because I felt like I was talking and nobody was taking the bait on my COVID vaccine. But then the MAs, the medical assistants, told me that in the afternoons, they were getting loads of people coming in. And they said, I think your talking is helping.
Good.
So even though they may not immediately said, bring on in the COVID vaccine, they were coming back after school and getting their vaccines.
Thinking about it.
Thinking about it.
Yeah.
Which, in private practice, I had to give them time to think about it too.
Yeah. So talking about COVID and the last couple of years, and what kind of effect are you seeing on your patients that might be in a lower income situation? How did it affect them differently?
Well, one of the worst things, I think, is we've lost like a year and a half to 2 years of schooling for these kids. And when you're in kindergarten and first grade, you're getting the basics, and you need to know your numbers and your letters before you get to second and third grade. And if you've missed those 2 years, it's devastating to their education. In private practice, I had families who were able to hire teachers that didn't want to work during COVID, have little pods at their house, continue the child's education. But in this group, they haven't had that joy of having the teacher come to them. And a lot of them, it's been on computers where they may not have computers.
Right.
And
or internet access,
or it is spotchy, or they have parents who work all day, and you're a young kid trying to get on the computer, And then staying engaged with the computer for 8 hours. I mean, it's gonna be very hard to catch these kids up.
Yeah. Well, I mean, I had twin second graders at the time when we did the shutdown and was trying to teach second grade math. And I'm a college educated woman
Right.
that was having a really hard
Right.
time with it. And so just, the ability to understand what's going on in their schooling and continue that at the home is really challenging.
When our parents don't speak the language, most of them trying to teach the children is really difficult.
Yeah, I can only imagine. So, I try to kind of see, okay, things were really hard during COVID, but I feel like there's a lot that can be learned from that. And so are there any things in your field or at your center that you guys learned for COVID that you might not have otherwise?
I think the most important thing that's going to come out of COVID for medicine in general is telehealth can happen, and it can be very good and save lots of people lots of time. They don't have to take a half a day off work to come to the doctor. They can be at their own home. And I have to admit, doing telehealth, I do it now once a week. I'm not running late on telehealth.
Yeah.
So they pretty much, if they have a 9 o'clock appointment, they see the doctor at 9 and they can get on with their day, take their child back to school. I think telehealth is going to change the way we deliver medicine. We did learn in medical school 80% of the medical exam is listening to the history of the patient.
Yeah.
And that's what you get in telehealth. You do miss maybe 10 to 20%, but it's been amazing how we can fill that in.
Yeah.
So I think telehealth will continue.
Yeah.
And will be beneficial for everybody.
Well, I think about, so I have had a whole host of very serious GI issues, and almost entirely when you go to a GI, it's just conversation about what's going on, right? And so I absolutely see how beneficial that's been. And just, again, when we're talking healthcare access, it's an easier access point to be able to provide it through telemedicine.
And we're having such a problem with anxiety and depression through COVID. There are not enough psychiatrists, there are not enough child psychiatrists, there are not enough therapists. So the pediatricians, we have taken it on ourselves to try to help in that situation. And telehealth is a beautiful means to do that. The child doesn't have to miss a whole lot of school. A lot of the parents are going to the school, taking them out to the car, and we meet in the car, and then they go right back into class. And they're getting that mental health care they need that's so desperate right now.
So tell me a little bit about that in terms of, you said it's, the anxiety and depression has gotten so worse. I know I've seen that in my own family, but tell me a little bit about that with the patients that you work with.
I had one child who, it was so severe. He was 11. And when the mom finally brought him in, I can't remember, he had lost maybe 20 pounds. He wouldn't eat. He was scared COVID would be in his food. And he had stopped eating. So he really needed to come in, and we needed to catch, this eating disorder. But the kids, the isolation has been very difficult. They don't have their routines, and kids need routines. They don't have their friends. They were, in my population, if you're in a dysfunctional family, it's just more when you're there, compounded every day when you don't have school, which can be some of these kids' safety place to go to.
Yeah, I was just going to say, and school is where a lot of things are identified if something's going on, either in the home or developmentally or any of those kinds of things. So
and food.
Yeah. And how
they
great
weren't
that
getting their meals.
Your program can actually provide food while they're there. I love that innovative wraparound service.
And we did that during COVID because we realized the kids aren't getting their school lunches. So people generously donated canned goods, and we strategically have them placed through the clinic so they can pick them up and not feel strange about it, or a child can say, oh, I like that. Can we put that in our basket? The kids get to leave with pretty much books and goodie bags, and we have women who knit, and give baby blankets, and then we have men doing.
I'm going to make you guys some baby
we
blankets.
love baby blankets, and we have men who do woodwork. And at Christmas, we had cradles with wooden dolls, and ducks on a stick, and ponies to ride. The clinic is filled with people bringing us things that just make the kids so happy.
Well, I love that. And so, you know, at the child care center that we run at Parkland, our director has a motto, which is, if it's not nailed down, the child can leave with it. Because it's that wanting to say, you know, these kids are already in a difficult situation.
Right.
But if you value them and you show them like, hey, yes, you attach to that stuffed animal, you can take that on home. Right. It just, and creates an incentive for parents to come back and keep seeing the medical care over and over again.
And I've only been at PD Place about 6 months, but I was seeing a patient a second time, and he goes, don't forget my goodie bag. I'm like, oh, I wouldn't. He was definitely coming back for the goodie bag.
But hey, he came back.
Yes, exactly.
Right? And so you were saying that for the first couple of years, you guys have a grant that covers so that kids can get all of those visits in the first couple of years. Is that correct?
I did not realize I brought some of my self-pay patients with me to Louisville. And one of my moms said, did you know that when I bring my child, everything's covered for the first 2 years? I was like, I had no idea. So I asked Larry, our president and CEO, and he said, we have a grant that covers the first 2 years, the kids that have no insurance and don't qualify for Medicaid, that they get their well care. So all they have to do is come to the appointment, get their shots. And, you know, there are probably about 12 appointments the first 2 years.
Yeah.
So it adds up very quickly.
Absolutely.
The other thing I've been interested in is at PD Place, we get city shots, which I also got in private practice, but we had we had one choice. At PD Place, they bring everything. So we can mix and match the vaccines to give them as few vaccines as possible.
Oh,
so instead of giving them 4, lots of times we only have to give them 2. And so I'm having to learn all the different varieties of combinations where I used to just automatically, they got 4 at 4.
Yeah.
So that's been pleasant.
Yeah. Well, so tell me, is there a particular story? I mean, the story of the little boy who wasn't eating is just heartbreaking. But, you know, are there any other impact stories that just kind of come to you as something that, you know, was really particularly, you were able to really help that family because of that situation?
Well, I'm still working to help them.
Yeah.
One family came into me, wasn't doing well on his attention deficit disorder medicine. Mm-hmm. And so I sat back and we talked, does this child really have ADD? So I had the mom bring in the educational testing. And going through the educational testing, it appeared that the child had an IQ around 70, which is quite low. Yeah. So I'm like, well, maybe this child just isn't going to be able to get what they need.
Sure.
And I ended up calling the person who did the testing at the school. And she said, oh no, he's got a much higher IQ than 70. But he didn't go to kindergarten. He just wasn't taken to kindergarten. In first grade, he was online, and the mom did all his work for him. Yeah. And now he's in second grade, and he has he can pick out 5 letters of the alphabet and 2 numbers from 1 to 10. And he's going to third grade where you have to process and comprehend what you're reading, not just read the letters. He doesn't know the letters. Yeah. So we've got to figure out what to go back and do for this child to get his basics so he can build on that, because he does have potential.
Right.
So that just showed the COVID crisis is just, it's really impacting these young people.
Yeah, and the problem is when you get that far behind, then catching up, because I remember when my kids went to third grade, they say that's the year that it switches from learning to read to reading to learn.
Exactly.
And if you're behind there, then it's going to affect kind of from there on out. So, yeah, and are you guys able to kind of work with the schools, or how do you start to try to address
and we
that?
actually have a clinic in a school at Central Elementary. It's in Louisville ISD. And we have one nurse practitioner that works there 4 days a week. And any school nurse in Louisville ISD can send kids into the clinic. It tends to be mostly sick kids or the years of the well visits when there are no shots. So we don't have vaccines in the clinic, but pretty much we can do everything else.
That's fantastic.
And our hope, we had our strategic board meeting, is to do this in Denton ISD too.
Fantastic.
So it has worked very well getting into the schools and having the providers there for the school nurses.
Yeah.
School nursing is a very hard job.
I can only imagine.
Very
And in the last couple of years, it would have been just
hard.
Yes. Hard.
They need a big pat on the back.
Well, and speaking of that, I mean, it's been hard on the school nurses. I'm sure it's been hard on everybody that's in the healthcare industry. And so how have you been able to cope?
Really has. And a lot of it you can't even verbalize. The stress of everything new coming out constantly. You're trying to digest information, give it as best you can to your patients, keep them informed of proper things out there and what they need to be doing. And the nice thing about COVID is we did have a little time to slow down and breathe and think. But we also learned we have to have some outlets. It can't be work all the time. And I like to do creative things. I like to knit. I like to needlepoint.
Get a sewing circle
going. Yes, it just lowers my blood pressure. So having other things to do is like been really important. I did move and downsize through COVID. A lot of people thought I retired when I left Baylor Pediatric Center, and I did not. I just moved on to a nonprofit. So, but the whole moving after 25 years was big. It was a lot.
Yeah. So, speaking of kind of moving from one, more of a private industry to the other, what has being a part of an organization like you are done to you? Has it affected kind of your perspective or how you view the world?
It has lowered my blood pressure.
Really?
Oh, yes.
Oh, I love that.
I just am so happy. My happiest times in general was when I go to Honduras in the summers and provide medical care for the underserved. And now I get to do that every day. So I just wake up looking forward to going to work rather than perhaps dreading 24 people waiting on me all day long. And being able to spend time with them and actually try to get their needs met. And having the time to do that, which PD Place has allowed me to do, it's just a very upbeat, respectful environment of everybody.
I love that.
And yeah, it's been a joy.
Fills your bucket to go to work, right?
It definitely does. I remember I liked being a doctor.
Yeah.
And during the midst of COVID, I was not liking it so much.
I can only imagine. So there's some things we like to do at the end of kind of every interview, which is talk a little bit about our belief that productive failure is absolutely vital, and just wanting to normalize that failure is okay, right? And if we do something and we take risks, sometimes it works out and sometimes it doesn't. And so just like to ask, do you have any failures, any failed forwards, anything that you'd like to share
I like
with our
that
audience?
failed forward idea. So I think the biggest worry and thing that upset me about leaving private practice was I'd spent 28 years building a practice at Baylor Pediatric Center, and when I left, they closed its doors. So there was no more Baylor Pediatric Center, and that felt like a huge failure. Like I worked my heart out for 28 years and I have nothing left to show for all that hard work. My sweet husband, who's in the healthcare field too, mentioned though, not to think of it as a building or a place, but think of the lives of all the kids you've taken care of. And they've gone out into the world and produced wonderful things and done incredible things with their lives. So even though there will no longer be a Baylor Pediatric Center, the children, it will live on, the families that I have met and touched along the way are still very important to me, and I still keep up with lots of them.
I love that. Yeah, it's not a building, it is the people that are in that building.
It is the people.
Yeah.
And it really took that for me to see the people's what it's all about.
Great. So while you're here, how can we help? What can our listeners do if they want to get involved, if they've been inspired by this? Yeah, tell us
There
about
are
what
a
we can do.
lot of ways to help. Knitting,
Great.
great. We have people donating things, new clothes. In the winter, we had people bringing us new coats. We had a whole rack of coats, and when we could tell that the child wasn't properly dressed, we could, swing by the coat hallway and have them pick out a coat. People with COVID, hopefully dying down, can come back into the clinic and volunteer.
Oh, great.
Doctors can volunteer, nurses can volunteer, subspecialists can volunteer. Obviously, monetarily, anybody can help out.
Yes,
half
always.
of our money comes from the Medicaid money that we generate, and half comes from grants and people donating their own money.
Speaking of which, I think we both our organizations received a Mavs grant this year,
It was
right?
awesome, yes.
Oh, that is so much fun.
So, yeah, it was so nice. I hadn't started working at PD Place quite yet, but in November, the office, we have 33 on the staff. They all went to the Mavs game and got the big check from the Mavs.
And it's like absolutely enormous, yeah.
And it was just very exciting. And what a great organization, go Mavs.
Yes, absolutely.
That game last night, it will get better.
Well, thank you so much for being
you.
here. It's just been wonderful to have you on and to learn more. We'll have a link in our show notes that people can check out if they want to learn more. And thank you. And so we're going to have our little kids video of the week. So take a look at that.
Inside there. Yeah, persons. Ooh. Cool. Now this is what I'm talking about.
Culture of Caring is brought to you by Mommies in Need, a nonprofit organization that has the mission of caring for kids so families can access health care. It's produced by Tabitha Evans and Real News Communications. And if you have an idea for a guest or a topic for the show, or you want to share one of your failed forwards, failed so hards, then please email us at COC, that's for Culture of Caring, at mommiesinneed.org. So again, that's COC at mommiesinneed.org. And please make sure to rate and review and subscribe wherever you listen. And we're also on YouTube if you want to watch this by video. Thank you so much for being here, and we'll see you next time.